Happy Thursday. Nice to see everyone. And thank you to the community of Lapine for hosting us. Lawnmower races in July, Frontier Days. Anybody wants to, I know, just put in a plug.
Oh, brother, give me a horse.
I'll go ahead and open the meeting for the Central Oregon Health Council, and we'll start with some introductions. And I know that we have some folks on the screen, but before we go to you, how about Kelly, do you want to kick us off? We'll go around this way and capture the room and then hit the those virtually. Does that work for you?
Sure.
Okay, great.
That's great. Hi, everyone. Kelly Adams, she, her, hers, Health Council admin. Which way?
Yes,
Way.
please.
Patty Dare, Deschutes County Commissioner, and I want to welcome Heather Kaiser, who is here representing our health department today. Thank you, Heather.
Linda Johnson, Community Representative, Central Oregon Health Council.
Carmen Madrid, Executive Director, Central Oregon Health Council.
Tammy Beatty, Chair for today and tour guide for the Health Council.
Gary Allen, Vice President Clinical Services, Advantage Dental.
Hi, Dan Stevens. I'm with Pacific Source and for the Health Council Board.
Miguel, do you want to go next?
Yeah, Miguel Angel Guevara, Project Manager, Central Oregon Council.
And Trisha, how about, we'll go this way and then back, Camille, and then we'll come over here.
Okay, Trisha Wilder, I use her pronouns, and I'm the CCO Director for Central Oregon.
Great.
Hi, Leslie Newbauer, Senior Director of Medicaid Governance Source. Hi, Lindsay Hopper, with Pacific Source, I use she, her. Erin Taylor, also with Pacific Source, she, her.
Great to see you in person.
Thank you. That's what I hear.
Yeah.
We also have the Central Oregon Health Council.
Great.
Carol Monson, Central Oregon Health Council. Michaela Arsenault, Project Manager at the Council. Hi, Heather Kaiser, new Deschutes County Public Health Director.
But have been with Deschutes County, then went to this little organization called OHA and
Can't get rid of me.
No, that's good.
I love it.
Welcome back. Yes.
Dustin Zimmerman, Oregon Health Authority.
Echo Murray, I'm here as a community member.
Wonderful. And we're excited to have you with us, Echo. We'll be right back to you.
Thank you.
All right, shall we go ahead, and Kelly, I might need a little help, but Brad, do you want to kick us off?
Hi, everyone. Brad Porterfield, Consumer Representative, Chair of the Community Advisory Committee, and Director at the Latino Community Association.
Groovy. Should we go to Jeff next? Jeff Davis?
Hello, I'm Jeff Davis. I'm with Pacific Source, the CCO Medical Director.
Excellent. And then to Mike Richards.
Hello, everyone. I am Mike Richards with St. Charles.
Excellent. Hi, Mike. How about Kristen?
Hello, everyone. Kristen Tobias. I use she, her pronouns, and I'm the Community Health Coordinator for Central Oregon Pacific Source CCO. Hi, Echo. I'm so glad you're there.
Hi, Kristen.
Wonderful to have you with us. How about Dr. Sharma, Divya?
Hi, Divya Sharma, Chief Medical Officer for Central Oregon IPA, and I also support Lapine Community Health Center. And I use she, her pronoun.
Great. And I think I saw Emily, and the boxes are moving around a wee bit.
Hi, everyone. Emily Solomon, St. Charles. Great to see y'all.
And how'd we do?
That's it.
Okay, groovy. All right. Anyone else that wanted to introduce themselves that hasn't had a chance to on virtual? Okay. Next, we have the consent agenda. Any additions, changes, edits? If not, I would welcome a motion.
So moved.
I'm sorry?
Do we have a quorum?
Yeah. Oh, right. 8, 9.
2.
Thank you.
Oh, that's right. We do now.
Sorry. Oh,
Okay, I have adoption of consent agenda.
Second.
okay. Any further discussion? Okay. How about anyone opposed? All right, motion carries. That'll be faster solution. We have a quick announcement of making sure that the board fills out their self-evaluation, which was sent out to you, and that is due back by May 15th. And so if you have questions or did not receive that, please let us know and we will get that to you. Any other announcements that we want to take? or public comment? I glazed over that as well. My apologies. Anyone want to provide public comment that? Yeah.
The message
Someone had it in the parking lot earlier, but we moved it.
believe that.
Kidding.
As long as we're piling it on, you should take note of the font size of your name to everybody.
You dropped all the too.
Oh, my goodness. Gary, I'm worried because I have. Between them. Okay. So next we will go ahead and turn it over to Echo. Wonderful to have you with us today. And so thank you for the community work that you're doing. So I'll turn it over to you before you share with us.
Okay, thank you. I hope it's okay if I continue sitting. I just got out of a boot on my foot, so just assume not put too much pressure on me. So thank you, Carmen, for inviting me here today. A little bit about me. I work for Walker Range Fire Patrol, which provides wildland fire protection in northern Klamath and northwestern Lake County, and I'm in charge of dispatching the community education. And some of the other hats I wear is I'm on the board for the Crescent Fire Department, part of the Gilchrist Homeowners Association, and there's a little more. Drawing a blank for a moment. But anyway, so a lot of hats, a lot of different volunteer organizations that I belong to. I've worked with Kristen on her and I are on a group for the CDC food security program. We've been doing that for about 2 years, and it's how I've got to meet Carmen and various folks, and a total eye opener. I'm usually in the emergency services realm, and now I'm getting more educated on that. And so just to kind of give an overview, I'm going to be covering a little bit of Walker Range, the Crescent Fire Department, the Schmaltz Fire Department, Crescent Community Club, and the KITC radio station. So we shall go forward. And I gotta take my glasses off to read. So a year ago, maybe, I think we got a grant through Carmen's group, and it was to engage in community engagement, I guess, with the community in North Klamath, and some updates to our Crescent Community Club. And so our first event on that is we are doing a community-wide shredding event, which we're kind of excited on that. We've never had that down in our local area, and we've been jealous of other areas that have gotten them. And then part of the grant too, we're going to have some food that we will be sharing with folks, and hopefully they come by and just to interact and have some social interaction with folks. Some of the updates to the Crescent Community Club is going to be, we're going to have internet set up. So we'll be more of a broad range facility for people. And then we're going to have a tech person help get that set up. Then that's going with I'm trying to read my notes.
You're doing just fine.
So Yellowknife Internet is going to be providing free internet service to the Crescent Community Club, which we're working on agreements with that, and they're getting ready to start installing that. So they've become a really good partner with us also. We're going to put in a security system. As everybody knows, things are changing in the world, and we want to make sure protect our building that's been there since 1956. So we want to enhance the building so it's for more of a broad use and people can rent it and different things. And through COVID, we rented it for, unfortunately, memorial services, but reunions and things like that. And speaking of COVID, that really did hurt us on our volunteer base. And we're slowly getting that built back up. And so it's not just 4 of us trying to run the whole organization. We're going to be working with Gilchrist School to partner with their summer programs and provide supplies to the kindergarten, 3rd grade, and that's through the grant too. So we're kind of excited about that. We invite everybody to the board meetings. It's the first Wednesday of every month at the community club. This year, we have been approached by a group of residents in North Klamath County, and it goes clear down to Sand Creek, up and everywhere. They want to do a farmer's market. And so they're looking at about 25 vendors, and I've been surprised that it's been a consistent 22 signing on so far. The problem is startup funding, of course. Our insurance said that we cannot insure, they have to have vendor insurance and individuals. So trying to get that, we've applied for some grants and hopefully get that so they can continue on with that. They want to run June through October on Saturdays, and that will be held at the community club. On to where I work, Walker Range. As I said, I do a lot with the outreach within our district. And so I administer a lot of mitigation grants. And so in working with people, the one thing is I hear over and over is nothing grows here. Well, it does. And so we have developed a Firewise garden as an educational garden that people can come and look and see different methods to landscape. If they're going to thin their property, they want to have some kind of beauty in that emptiness. And so there's a lot they could do, and we've incorporated different things. But 2 years ago, well, a little over 2 years ago, Crescent Municipal Water System lost a well, and that we had to turn off our watering systems. So it's kind of wild and woolly down there in our gardens, and all the watering systems calcified. And so I applied for a grant for garden rehab through State Fire Marshal's office, and I was awarded that. And so we are going to be redoing our gardens. And so hopefully by midsummer, towards the end of summer, please come by. Weekends, I'm down there in dispatch. So come and look at that. We are going to incorporate more Firewise practices, drought-related planting, and Carmen fruit trees for the food thing. So we want to show people that they can produce and be a little more self-sufficient there. I got some of the state of Oregon 762 funding. I don't know if everybody's familiar with that, but that ends June 15th. So we're kind of scrambling to get everybody done and get that so I can do a final report and invoicing for everything. I just went to Crescent Lake area about 2 weeks ago. They still have 2.5, 3 feet of snow. And so we're going to have to readjust because there's just no way they're going to be able to do any of that work. But that's kind of was a shock to me. And then we applied, Walker Range did, through Klamath County for the ARPA grants. So we're getting a backup generator system for our offices. We need that in dispatch. We consistently run out of power through windstorms or whatever. Our local radio station, KITC, applied for an ARPA grant for an upgrade to their radio systems. And so that, between what I have on our social media and emails, they reach quite an audience. And so this is going to be helpful during the emergency services. And so anytime, and they kind of cross different boundaries. So, you know, anytime anybody has information they want to have put out, you know, press releases or whatever, they would be glad to do that. Now on to the other fire departments. Crescent got a SAFER grant, which helps with their staffing for the next few years. They're a small department. They're basically the only paid department in North Klamath. And so this will be definitely a help to offset their budget. They did get a fire truck through the fire marshal's office, so that helps. They got a wildland truck. And then Shemalt Fire Department got a chipper, and so they haven't gotten that yet, but they got awarded that a grant, so we'll be working on helping them set that up because we already operate one, so I volunteered to help them get that whole procedure set up. And then Crescent has gotten various awards for personal protective equipment and other life-saving equipment. So everybody's working hard down there on doing the grant world. And the other day, Keep Oregon Green, May is Wildfire Awareness Month, and so Keep Oregon Green does these coffee sleeves. So hopefully you'll start seeing these in the coffee drive up shacks. And so I just delivered to all of La Pine just yesterday, and so I only got about 100,000 I got to get rid of. So if you guys know, I need help. I need to get rid of them. I should have brought them and given them out, I guess. But I'm open for any questions and any suggestions on anything that you guys see that we need to do different. Yes.
One of the last times I was at the community center meetings, there was a lot of discussion around transportation.
Yes.
And how, and I wasn't sure what the update was on that, and mostly medical transportation.
Right. Yes, that they gave a report. Basin Transport or Transportation out of Klamath Falls has worked where they've got some that's funded through their tax base, and then they have a section that is not. And they came up in this month, and I think it's maybe next week, they're gonna find out whether they get approval for 2 vans. And thank you, because community or the CAT team was the other group I forgot to say I was part of. So they will have 2 vans, and they will be hiring local drivers to start being able to meet up with the Central Oregon transportation here in La Pine. And they're saying they can go off highway towards the subdivisions, like 3 miles or something like that, which does, if you knew any of our subdivisions, doesn't get you very far. They're all very much rough off-road type, and winter conditions can really play into that. But yeah, they're going to be doing for grocery runs or for veterans and medical calls, and so that's still in the works. So they've made some really great strides. Yeah, real excited about that.
Your partnership with So Ready, do you work with them in terms of economic development? And if not, we might, it piqued my interest in terms of the vendor market and the insurance. If there's an economic development connection. We at COIC have an economic development department, but I think it'd probably be best to start with So Ready. Are you familiar with them? And
no, I'm not. The group down in Klamath has approached me, but that's not till their next cycle or something is in fall. Which that doesn't help with the media.
Okay. Well, I'd love to get your contact information. There might be some assistance that we'd be able to provide as well.
Oh, that would be wonderful. Yeah.
So do we have, okay, very good.
Yeah, I didn't bring any business cards.
No, that's okay.
I walked out with that though. But yeah, thank you. That would be great.
What do you do in your free time?
I got yeah. I usually would fall into sleep. I just gotta get there. Yeah.
What I love about this conversation is that we serve the Northern Summit area, and we also don't get an opportunity to hear about the great work that's going on. And so both from the prevention of wildfire, being able to protect communities in terms of defensible space, those are all really important public health aspects that also don't usually get hailed as really critical. So just wanted to say thank you so much for the work that you're doing, but most importantly for sharing with us the work that's being done, so that we can be educated to share that as well.
Yeah, and anytime, that anybody has a phone call, I don't care that it's across the boundary, not in my district. Education is education. And if I can help, broaden that word, that's a good thing.
Yep, and fire doesn't usually care about those.
No, right, no, it turned out,
More than the smoke, yeah, exactly, right, and nor does disease.
yeah.
Yeah, I just wanted to share, echo and say thank you so much. We, as a CCO, had an opportunity to partner last year with our friends at OHA to distribute air filtration units. We did that through the Levine Community Center last year for our Medicaid members with qualifying medical conditions, but I thank you so much for showing what the front side of prevention really looks like in this space in regards to just trying to provide assistance when there's smoke, which we hope to be able to continue to do, but it's just really great.
Thank you. And speaking on the smoke, there's a monitor in Oak Ridge and there's a monitor here in Lapine. And we were kind of amazed that in 21 and 22, that there was 276 days in just from June to October that we had unhealthy conditions in the smoke. And Jennifer Little at a clinic health down there was talking to us about setting up and rehabbing our community club to be a place that people can come for the smoke. So we're looking at that, and I think unfortunately we need to have a feasibility study done for the community club, so we have that to be able to participate in the grants, because DEQ, I think, had a grant open for doing that.
Yeah. And with only 4 CCOs qualified in the state, and us being one of them, certainly highlights the challenge.
Yeah, definitely.
Thank you for all your preventive work in that space.
Thank you.
Hopefully we'll continue to provide solutions on the other side.
Great, glad to hear it. We need to work together.
Any other questions or comments? Okay, well, please stay.
I think I will. This is interesting. I did, and I'm glad to see somebody else gets picked on besides just me. And
He's earned every moment.
yeah, I usually I do too. Good smells.
Love it, love it.
Thank you, Echo. Yeah.
And thank you, Carmen, and the team for bringing Echo and having an opportunity to learn from you. So thank you. Okay, Trisha, shall I turn it over to you? Sure. Okay. Can we pull up the Kelly, I'm looking at Kelly.
Should we do a sound check in term? This room might be wired to the hill. I know when there's remote, it's always good to see other people hear from different sections of the room. So if Trisha needs to move, I'm sure she would be willing to.
We no longer can see you out there. Christine, can you hear us? Dr. Davis? Okay. very
I
good.
can hear you.
Yeah, the sound quality is pretty good.
Yeah,
now.
we can hear you.
All right, great. Great.
Well, that's definitely not normal.
Yeah. Meetings. Yeah. Love it. Great job with the setup. And so page 30 in your packet. And yes, yours. Great, thank you. As you all may recall, this is now our first time going through these metrics in this format. We established the new format for 2023 with these 8 monitoring metrics. Just an overview before we dive into all the metrics. They really are, 2 are just off the mark. And 1 we're missing, and we expect that. So I just want to preface that going into these metrics. We're rating them on yellow being caution. Well, maybe we should start with green. Green being go and good, yellow being we're paying a little bit more attention. There's some cautionary tales maybe in this space. Red is a full stop, full focus. We have concerns. So nothing red in this quarter. And the couple of yellows, I'm going to go ahead and address each of the yellows by their section. So let's go ahead and start with the quality and member experience, which is the first 2 metrics at the top of the page. I mentioned that one of these metrics we expect it to be in the yellow, and that is our quality measures. So although we hit a huge home run in 2022, where we not only met 100% of our QIMs, but we also met all 4 challenge pool metrics. I'm pausing for applause. Not that we're yeah, but if there's a scorecard, we're winning. Yes. What that means is our members are
That's out loud, yeah, that was out loud, okay. But as we begin each year, let's use Lapine Community Health Center as an example. They may have 30 kiddos that they need to get a well child check for. They probably didn't get all 30 in that first quarter. So we watch the metrics as they grow, and we connect with the individual members in each category. So again, we will expect to see this yellow unless, yeah, I mean, we will, I'll just hold that. We will expect to see this yellow until the fourth quarter, and then even sometimes still yellow, waiting for those final members to come in and either get their vaccines or have diabetes or have follow-up from a substance use disorder visit. So all of that in work, and again, where we would expect it. Noted in the description is some work we're doing with Boost, which is really exciting, and that's specifically to help us lift up the HPV vaccine, which is part of the adolescent immunization, and really the challenge to us meeting that metric in that space. And that's one of the metrics we did not meet last year. So focusing in on new ways to do that work. Spoiler alert, we're bringing some Boost recommendations to the provider engagement panel for recommendation to include some dental toolkits as a way to expand the way we're having conversations around oral cancers and HPV with a trusted provider partner. So a different, fairly unique approach to that work. So we're excited about that work. Does anyone have any questions before we move on to the second measure there?
Not really a question, Trisha. More of an observation, having been in Oregon now for way too long, 20 plus years. And working in immunizations in another state, and recognizing how state policy and local systemic policy really does impact immunization rates, whether you're talking about adolescents or children. Is there any initiative, Dan, Trisha, that we're aware of, sort of look at the system and see what are the system barriers to immunization? And, you know, not just blame it on parents because they've got bad information and research. Are you aware of any conversations around that?
I think those, I mean, I'm speaking for myself, Heather can probably, Heather and I have felt experience together, but you know, we, before pre-pandemic, maybe 2017, 2018, around that time, Deschutes County Public Health implemented the AFIX program, which is a CDC evidence-based program that boosted our immunization rates for children 0 to 2 at that time by, I think it was 9 to 11% in 1 year, which is, as you know, astronomical in this particular space. And that was really around looking at clinic workflows, supporting providers, making sure that they are feeling supported and educated. And you know, I know that blaming the pandemic is unpopular these days, but that really had a huge impact in children and adolescent immunizations and immunizations of all kinds. But it's, and I don't know what the status is of that programming at the county. What, I mean, we had a, do you know the same?
Yeah, I
do. Go ahead.
Yes, so it used to be called AFIX, it's now called IQIP, which is Immunization Quality Improvement Project. And we now in Deschutes County, with a grant from the Central Oregon Health Council, have reinvigorated that project as of late the fall of last year, and we have 18 clinics signed up. And we have a coordinator who is really working with those clinics that goes in, they look at their rates, they talk about best practices to increase immunization rates. The huge one is that fourth DPAP and ensuring visits are happening in between that first and second year, because that's often when rates drop off, is that first and second year and getting kids in with their well child. So it's promising, and as Leslie mentioned, last time we implemented this back in 2016 for 3 years, we saw an 8% increase in immunizations just by doing this program. So I think it's going to be really effective. And yes, I think COVID's had a huge impact. I think adolescence is challenging because I don't know about you all, but I have teenagers, and that getting them in for those well child visits can be challenging for some parents. And I think whether it's an access issue, I'm not sure, but I think it's also getting creative on where else are adolescents. Pre-COVID, we in Deschutes County also worked, this is just an example, with the center during their free sports physicals. And we actually provided adolescent vaccines during those sports physicals, because oftentimes kids they think, oh, sports physical, that's my, well, child physical. It's not, as we know. And so I think we need to kind of start thinking creatively of where adolescents are and their parents to kind of increase the rates when it comes to HPV, meningococcal, and Tdap. So, and as far as system, there is no plan at this point. You know, we have the school law as far as immunizations for school, and there's no indication that HPV will become a requirement for school in Oregon. So that's what I know so far.
Thank you. Do we have anyone from the region who's on the school advisory immunization?
I don't think so. I'll find out from our region. I'll find out who's on it, and those are kind of things that myself or the other two public health directors.
We might want to assist in just providing some input. Anyway,
I'll reach out.
And I'd actually like them to talk about what they're feeding the kids in Deschutes County on the lunch menus. I've been really paying attention to this. Emerson Levy, Rep. Levy's daughter, she said, oh yeah, they've got low-fat chocolate now for her daughter's school. But they're serving Pop-Tarts and Lucky Charms on the list in Redmond schools. I mean, guys, I cannot believe the amount of sugar that our kids are seeing on a daily basis as far as their food choices go. And, you know, coming out with bariatric surgery because of the obesity of 20% of American children is really wrong. And we're the health council. I really would love to see that issue.
Yeah.
And somebody needs to be on that, because how is that still happening today? How are they still giving those kids so much sugar?
yeah. And I think we're fortunate to have you as a champion for that too, because it's an
I
important.
keep repeating it and I'm going like, oh my gosh, the numbers are projected. They're just going up. 20% kids, 40% adults. And look at pictures of Americans from the 1970s. It's like it's really, and it's so impactful on our health.
One of the things that we're starting to do with the provider engagement.
Well, it was brought up that, obesity, Divya was chairing that, and that, it really does need to be a focus area. And I personally like it because it's an area where we can integrate oral health. Because you talk about looking at pictures, look at pictures inside the mouth, the last 20 years, I've been in this business of dental for, prevention, but 50 years. And it's getting worse, and we have the tools to prevent it. It starts with nutrition, but I just don't think we engage enough about nutrition. And it's kind of interesting to at the meeting to hear Jeff and Divya talking about it, and other physicians that patients come in now and they want a quick fix, medication, surgery, without looking at the upstream or preventive measures that can be done. Yeah, I think we're all in agreement. It really does need some attention.
Well, I was just shocked. I mean, 2023 and those kids are getting Pop-Tarts and Lucky Charms. I mean, amazing.
The dental office with Cokes, little kids.
Yeah. I know, I never know what to give my dentist for a present, I never know. I can't give him candy, probably not liquor, so what do you give your dentist for a present? What do you like, Dr. Allen?
Yeah. It's okay.
I deserve that, I deserve that.
So I do. Well, talking about nutrition, I do have to do a shout out. I just think with this team is Women and Children program. Actually, county health department do amazing work, with that early intervention and teaching parents how, healthy cooking. They do classes. They do a lot around nutrition and breastfeeding. So I just want to do a shout out to the women.
Excellent. Okay.
So one of the things I'd like to share in relationships to our quality conversation is that
there's a quality incentive measure work group that does just this work that meets monthly. But just a reminder, that's happening here at the Health Council as well. And then I'll share some other good news. We are currently trending higher in well child checks than we started last year. So the trend is going in the correct direction. So good start to well child checks. So all of our provider partners, and I see Koba here behind us. So thank you so much for your great work in those spaces with our team for sure. So we'll move on and talk just a little bit about the percent of members with a mental health service need who received a mental health service visit within the measurement year. I think it's important to call out here, 63 is so close to 66, first of all, so close. Secondly, this is a self-imposed improvement metric. This is not a metric from the state that's been identified. This is based on our previous performance and our internal goals. The other point to share in this space is 66, excuse me, is really our goal for the end of 2024. So we have a lot of runway here in this performance improvement plan. And then the one sentence I would like to share is that the CCO is the second highest rate reported for all CCOs in Oregon. I did not write that in case somebody wants to call me competitive again. But again, we win, our members win. So we are on the right target. We're on, excuse me, I won't use the word target, but we're on the right process here in this work. It's just going to take some time to implement some of the changes in the system that we're working on.
And certainly far ahead of the Midland Valley.
Right. We'd love to call out one of our non-CCOs.
Part of me wants to know who's number one and what are they doing that we're not.
Yeah, I think these are great questions to ask. Exactly, it's lame. It's us. Yeah, and we do a lot of cross collaborations.
You said Lane was number one. Okay, I just wanted to make sure everyone in the room hears that. It's you, Jane. Okay, we'll get better.
Yeah, they're us, we're them.
I think I heard game on.
Yeah. Okay, great. Well, let's move on to CCO 2.0 requirements then. Again, both green here in this space. What I want to share in regards to the value-based payments and land framework is that Carmen and I have invited Peter McGarry, who is the Vice President of Provider Network, to come and speak at this meeting in August. He's done this well once in my time here with the Pacific Source, so perhaps it's been a year and a half since he spoke. So we'll have him back to discuss this complex framework and what does it mean when we say things like 2C and 3B and all of those things. So he'll walk us through that, which I think is incredibly beneficial. Until then, if you have burning needs in this space to learn more, there is a page within the CCO performance Excel document that was sent out. So there's a sheet there that talks more and also provides links for more information. But important to know we're continuing to be successful in that space. As we are with the population reach for unique members in our integrated behavioral healthcare settings. Great news is we had 17 participating clinics meet that requirement. And the 6 that did not are going to have the benefit of undergoing some technical assistance with our teams to help.
They have the opportunity.
They have the opportunity. Yeah, to achieve that as 17 of their counterparts did. So working there through, again, the strategies that were noted in the initial Excel spreadsheet that went out. Financially, we are trending very well right now, operating gain of $3.4 million right now with an estimated shared savings at $8.1 million for 2022. So we're doing a look back in that space. Excuse me. So that's very exciting, especially as we're rolling towards redetermination where these numbers will likely be different going forward. So we will enjoy this and invest wisely in upstream. So we're helping prevent a number of the challenges that we're dealing with every day. And we continue to hold in the well-managed category for our ED utilization. The current number, is it there? Yes, it's 408. And just to give that some context again, in that if you remember the blue, yellow, red, that keeps us in the blue. And last year at the end of the year, we were at 403. So we were right on the cusp in the same space with ED utilization. So great work being done there. I'm going to pause. I don't think I paused for requirements or stability. See if there's any questions in those spaces before we address the last operations components.
Not yet, but if you are joining us virtually, we are unable to see you. So feel free to go ahead and just chime in if you have a question or a comment.
Thanks, Tammy. It's Iman. I just wanted to let everybody know that I was able to join. Sorry for being late.
No worries. Thank you for joining and thank you for letting us know.
Great. As we lead into the last two metrics then in operations, we are holding in the NEMT marker at 20%. So still lots, tremendous amount of work being done in that space, and transportation, as we know, is tremendously affected by the workforce shortages. There's some really good hiring happening in those spaces. And we are hopeful that access improves in that space, we will see a lift. The same thing is happening very similar with our dental providers. You can see we're still, I mean, to have a target at 0.7%, it's less than 1%, if you will. So we are barely over that at 0.8%, and there's a lot of work being done to improve access and services in the dental space as well. So as you may recall, we had Jessica Waltman last time and talked about the grievances appeals process, and she has a team, and the amount of work, and I wish our members knew how serious we took it when we experienced grievance and appeals to improve the overall health system, and her team does a tremendous job with that. So I would just expect to continue to see improvements in this space. And again, we're so close.
And I'll comment, so anytime there's dental, I feel like I have to comment or want to comment. Any attention to oral health is good. Carmen asked me if I was getting tired of hearing about oral health access. And actually, no, because again, any attention to oral health is good. But to further comment on what you're talking about as far as serious and civil grievance appeals, Pacific Source has quarterly meetings with the DCOs. And that's a major agenda item, is going over the appeals and grievances. So a lot of attention is being paid to that. I also mentioned to Carmen too on oral health access. So I think we do have to set realistic expectations. It's not all about dentists, and I don't know if anybody's aware, but there's a 20 million ask to the legislature for the oral health workforce. All the dental stakeholders have gotten together, and CCOs as well. Not that we expect to get $20 million, but that's factor out. None of that is for dentists. That's all for our support staff, which is where the real problem is. All the way from alternative training programs for dental assistants up to supporting the dental assisting and dental hygiene programs that we have in the state. So there's a lot of attention, but none of that is going to be in the next quarter, the next year. That's all downstream. And so, yeah, there's a lot of attention being paid to it. But I'm also concerned because we're already seeing it, that with redetermination, we're seeing a lot of people who feel like they are at risk for being terminated from the Oregon Health Plan, that are putting a lot of pressure to move up in the queue to get all their work done. And, I anticipate some grievances associated with that because we can't move them all forward. Just to put a little more context.
That's helpful. I believe yes, Linda, and I think we have Brad also, who, if he's still okay, very good.
Brad, he's probably going to speak. Same thing I was going to speak as catcher.
Okay, very good. Brad, do you have a question or a comment?
Yeah, it's actually way back to the first section, so I apologize, but I didn't realize you couldn't see my hand. Question around immunizations, whoever it is that's really focused on that metric, are they spending time meeting with families that don't support all immunizations? Like to get feedback, to understand where people are coming from? There's a lot of families, including mine, that don't align with all immunizations.
Yeah, I'm gonna lean in, and Brad, our partner at COPA is here, so she's gonna lean in and talk a little bit about how that transpires in the clinic.
And I know you joined us after introductions too, so feel free to just, yeah.
So I'm with COPA, I'm the director of finance, so I'll. I'm the director of Operations is out today, so I'm filling in, but I am a little bit aware of this process. This is a concern that we have also had. Our providers are actively having conversations with families when they came to come in and they come down during visits about vaccines, the benefits of vaccines. We are looking at creative ways that we can better engage our families and to have those conversations. And I know that we have some kind of programs that we're looking at internally and how we're approaching that. But I don't believe those are ready to implement or up and running. But we do recognize that that is a challenge and that we are actively looking for creative ways to address.
So I would add, this is another one that Boost Oregon, and they would be great to present at some time, because they're a nonprofit that really started because of this and the need for parent education and an opportunity to kind of for parents to share their concerns in a safe environment. So they hold community workshops around the state, and there is a coordinator within Central Oregon who works with the provider offices, and they train different providers to do these community workshops for parents. Because I think this is a space where a nonprofit who's kind of independent can really provide that education. So that's what I know on that side, but this is definitely an ongoing concern. So Brad, I would love also any suggestions from your end on how we can better engage.
Yeah, I think, whoops, go ahead.
This is Heather from Deschutes Public Health, by the way.
Yeah, I can't really see your face, so thanks. Yeah, I think it would just be beneficial. I happen to be in that group of folks, and the research shows that it's the most educated folks that tend to resist vaccinations for their families. And the public health folks generally aren't really open to hearing other points of view. That's been my experience. So I'd be happy to, if I have the time, meet with somebody to kind of guide that or give some input. But I think the public health field could be more welcoming to other points of view. I'll stop there with that topic. The other with interpreters, I'm just curious to know if, I don't know if it's the CCO, sorry, or who it would be, but on that metric, I'm just curious to know if you're talking to the professional interpreters and in particular the companies that provide interpretation. And the reason I ask is I had the opportunity to speak with Elizabeth Sanchez, who's the language access coordinator for Deschutes County or Deschutes County Health Department. And she also runs her own business that she started a year or two ago. And so she's contracting, and I don't know if she's actually a contractor with the CCO, but I think so. But she had a ton of good feedback and input. So I'm just curious to know if you're speaking with those folks.
I would love it, Brad, if you could shoot me her name and I could help make those connections in that space. And I'm glad that you are asking some questions in the space. We just had a meeting yesterday where we discussed what we launched internally in regards to our culturally and linguistically appropriate services. And as you all may recall, we went above and beyond what OHA asked, and we created our own certification training. And we successfully just graduated 10 people from that training that are headed to the registry at OHA, which were 30, 60 days-ish out before they're in the registry and able to do that. Even better, I can tell you in the class starting in June, we have 19 people signed up for that. So we are really excited about the work in this space and really hopeful that we can lean in a really meaningful way instead of relying on our partners. We're saying, you know, we're going to dedicate a training person to this work. She's doing an incredible job. It's a commitment by people who attend, and then it's also a commitment with the employers. So we have Mosaic in the room here, volunteers in medicine. Actually, I don't know if Megan's on the phone or not, but they were part. Oh, and Kat, I see you, Kat. I see your name. Part of that first cohort. Kat, I don't know if you want to lean in and share any experience in that space, but we're very excited about this program and hope to continue to grow.
Yeah, we were very thrilled with the program, and we had our first volunteer go through and is certified. And then we have another one lined up for the next cohort. So we think it's a great idea. And we really appreciate your partnership in letting, the free clinic participate as well. So thank you for that.
We had 100% passage in the proficiency exam, which we were super excited about. And we're doing an in-person training in the Gorge. So if there's opportunity, as you think about your staff and other folks in the community, if that's something that you'd like to work with us on, we're open to doing that. And we plan to do monthly virtual trainings, most months, maybe not every. I think August, we're going to take a little bit of a break because everyone's off enjoying the outdoors, but most months we're planning to do at least virtual, if not in person. So really excited about the uptick and the interest in the community.
I just wanted to bring that back. I don't know if you all remember, but Heather and I were working together in 19. And Sherry Hill from Bend had a legislative bill, House Bill 3063, with tougher vaccination rules. I actually somehow, I had a map of the state of Oregon. Our county was getting dark blue because people here were not vaccinating. This is in 19, before COVID. Somehow I had the map. I was able to talk the commissioners from across the state into actually supporting that legislation. And I don't believe it would ever pass in today's world. I just want you to know. And honestly, I would like to see the map in today's world where we really are at, because as I tell Heather, I don't want measles, I don't want polio to come back. What is it that these children are missing? Like what Brad is saying, there's several sides to the story now, but definitely in 19, that's what I was able to do. And today, what is the truth out there? I asked the county to do billboards. I go, please remind parents, they need to get their kids vaccinated. If we just have a couple kids get vaccinated, I think it's worth it. So anyway, Heather, I know we'll be working on this.
Great. Oh, Linda, yes, please.
Yes, back to the topic of the dental improvement and setting that as a goal. I recall it was about a year and a half ago, maybe 2 years ago, that CAC brought this to the council as an area of serious concern. It would be great if the woman you referred to that's taking leadership on that program could come back to a CAC meeting and close the loop on, because it's very empowering to me. They made their voices heard. I'm sure we convened the big work group, Pacific Sources partners with us at Target, and here's what the results are.
Thank you. Are you on that? Yeah, for you and Brad. Yeah, I would strongly support that. And I don't know that complete bow was tied around that work at the CAC level, because I still see in my notes, the CAC is continuing to focus on this metric as an emerging issue. So I think both sides from the board and the CAC may not have closure in that space. Might make sense. Great.
Okay. Other comments? Okay, ta-da. Wonderful job. Thank you for your hard work in keeping us organized and following all of this as well. Incredible success and movement in the translation services and interpreting services. I mean, I know that was a struggle of how are we going to make that happen, and to have that many individuals, and the notation that 100% proficiency tells me that the program itself is meeting the need. We have a lot of people that are not able to make it through that process. It tells me there's a little something that might be wrong. So great job. Do we have other questions, or are we good? Okay, very good. All right.
I do have a question about
please.
The loss. Okay, so we're 2.2 million behind what your budgeted gain was year to date. How many more months of the year are we looking at?
We strive to close financials in August. So we should, is that your question?
Well, yeah, just what is it, 3/4 of the year that 2.2 is, it's less than what you really thought.
Behind the
right.
Statement but I think that in our next in 2 weeks we can address that at the final.
I just wondered if it's getting short.
Short answer, 9 more months.
9 more months.
Yeah.
Okay.
Still super early in here.
Okay, so it's really, because it's public knowledge, we're self-insured for the county, and we went through millions of dollars. COVID really caused more problems than you could ever imagine. The fact that we had 8,000 elective procedures not being done. Yeah, the health problems that we're now facing are significant, and you know, you never know. You could get lucky, but we have really, it's made a huge difference. So if that's only through a quarter of the year, yeah.
And the budget being our best guess with the information we have at the time.
I know.
Through adjustment with this, so good to call out that variation though, and that 2.2, and I think we can, with Carmen's guidance as well, lean into that in finance committee and look at that variance.
Well, I just know that healthcare is one of the fields where inflation is really impacting, because they're having to pay their help so much more, and then there's, you know, they're short a lot of help too. So, you know, there's a lot of different variables that we're dealing with.
Thank you for that. It sounds like we have another question. Brad, do you want to share your question, or you want us? So it's a question around, are the new field of interpreters in the Central Oregon area?
Many of them are, we had several from the board
Okay.
as well. But I think it was sort of split between the board and some board and the school board, but I can find out.
That would be great, because if we still remain in the space of a gap, that would be helpful
And
to
again,
know.
monthly on going search and see.
Sure. And where those 19 might
Yeah.
be hoping to provide service. Brad, anything else?
Thanks, Tammy. No, just in general, it'd be great whenever we get statistics, if we could break that down so that we understand where the Central Oregon Health Council, not the CCO, not covering all Pacific Sources region. So just to make sure that's clear for us, I'd appreciate it.
Great. So on to the next topic, and I'll turn it over to Carmen in just one moment. And I know that we have our consultant with us as well, which is great. So we have in the June timeframe, so June 8th, we have a board retreat. So if that's not on your calendar, hopefully it is. I know that we've sent out some invites, so we hope to see everyone from 9:30 until about 4. 9:30 to 10, I want to bring the group aware, or 9:30 to 5, I think we're going to have a little social time, hopefully. And so we will be having an executive session to have an opportunity to talk with the board about the feedback that you will all be hopefully providing in the survey that will go out tomorrow, so that we can give Carmen feedback on her annual performance. And so we will be sending out a survey to you that is separate from the board evaluation survey of your own evaluation. And so we will be having an opportunity to share with you at that June 8th meeting to talk about the information that we've gathered, and then we will be meeting with Carmen after that. So that will be going out tomorrow, but want to let you know that the survey that you've been asked to provide information and feedback on by May 15th will really help inform the retreat. So we have an opportunity to know where the board sits in terms of knowledge, engagement, and understanding. So please take a peek at that. And again, if you don't have a copy of it, we will send it out. Want to also turn it to Carmen, because we will introduce our facilitator who will be joining us as well, and then going over a little bit of the goals that we hope to achieve. So one last thing I'll say, and Brad, I don't want to speak for you, so keep me honest and make sure I don't miss anything here, but we had an opportunity to chat about the engagement of the Community Advisory Council and how we might have the opportunity to provide input into the strategic planning effort together. And so we are going to be, with Carmen's direction and the team's guidance, be able to, at our September joint meeting that we hope to have with the CAC, we would be looking at the strategic planning efforts that our consultant has been able to put together into a document, be able to refine that together, see what's missing, see what the CAC is working on, what we will be working on, how what we're working on comes together in the middle. And so anything, Brad, there in the connection of the CAC with our overall work in strategic planning that I might have missed?
I think you covered it, Tammy, thanks.
Okay, so anyone wondering where the CAC influence will be, that's what we're hoping to achieve at the end of the day there. And so Carmen, I'll turn it over to you in terms of our strategic planning effort that we can anticipate for the 8th.
Okay, thank you. Well, before I start, I just wanted to thank the board for Having brought this in.
Yes, we're celebrating an anniversary, so we've survived a year.
Yeah, I survived a year.
A little over, but yes, and so wanted to, on behalf of the board, we have a gift and a card and just an opportunity to thank her for surviving the year, staying on the year, and hope that we get to continue together for many, many more. So it's just a little something to say thank you, and we appreciate you very much. So that's, yes.
Well, I just wanted to say, I appreciate the board. I received a lot of guidance and growth during this year. And I'm really excited to move through our strategic plan and start our next cycle. And all of this would not be possible with the support of our staff. They're the ones that really lift up our community in all of these work groups and make it happen. So thank you for your support.
Yeah.
All right. So with that said, I just wanted to go ahead and turn to page 36 of your board packet. And the idea of giving you this high-level strategic plan, believe it or not, we are in our fourth year of our strategic plan. It will end next year, 2024. And just to set some context, my understanding was that this strategic plan was built in the middle of the pandemic. I think it was in March of 2020. I don't know, Michaela, I don't know, you all were there, right? So, you know, with that said, this plan will continue to move forward anyway. And what was really exciting about seeing this plan was that most of it has been accomplished. And the homework, if you will, for the board members for our board retreat on June 8th is to really take a look at this and lean into the language of what we had intended. There are 6 strategic directions. I'm not going to go through each one of them. And what I've done is looked at them and categorized them even tighter as a team. And I will be introducing Laura Bickle here shortly to you, who will be facilitating our strategic plan refresh during the board retreat. And I believe, like, once we go through this, there's a status column. And as you see, I really wanted to do green, yellow, red, but I felt like a strategic plan doesn't really do that. It's evolving all the time. There are things that are as planned, those happened. We didn't have problems going through them. There weren't any timeline issues or anything like that. There are things that are in progress, which feel really, really good, which means that we're on track for a lot of those items. And then we have evolving items. One that I could call out is the cost utilization steering committee. So that was something that was started. However, I do believe it's evolving into something else. And, you know, with some of the work that Pacific Source supported last year in, you know, ER utilization and looking at those measures, I think there's, in that example, there's an opportunity to look at how do we measure our success now? How do we measure the things that we've invested in? And so those are the pieces that we want to look at, both in, you know, savings for cost and cost avoidance at the same time. So this is the work that I would ask the board to take a look at. And the way that we're really going to try to frame it is we're going to spend about 20 to 30 minutes on each, but I'll have presentations. So we're not just like looking at a spreadsheet. And so, for example, in the community information exchange space, Brian Wetter will be presenting and talking about a proposal for closed loop clinical referrals. So I'll have more details around that, and we'll have some different guest speakers. So anyway, I'm excited about moving this forward, and any support or questions you have before the retreat would be great. And I'd like to introduce Laura Bickle. She's really helping the team, the executive committee, design this in detail. Hi, Laura. You go ahead and introduce yourself. Your background.
Thank you. You'll have to forgive my connection is poor. I'm traveling. I'm currently at my grandfather's house, and it even appears my video is frozen. Can everyone hear me at least?
Yes.
Yes. Okay, wonderful. So my name is Laura Bickle. I have been a self-employed consultant working primarily in healthcare strategy, development, and deployment, working from the front line to our executive teams since late 2020. Prior to that, some of you may know me, I worked at St. Charles for 6.5 years. So I've been excited to be partnering with this team since November, and look forward to our time together on June 8th. Thank you.
Anybody has any questions on what the ask is for?
Review the material, fill out the survey, be present on the 8th. Right,
Mhm.
okay. Kirby, any questions? Yes, thank you, Laura. Enjoy your travels.
Thank
Okay.
you.
Yes. So next we have Mike Richards, who's going to give an update on the pedal clinic.
All right, good afternoon. Can you guys hear me?
Yes, and we're pulling up your presentation right now,
All right, thank you.
of course.
All right, if you can go ahead and go to the next slide. So I think hopefully everyone's aware of the background, the bridge funding that the St. Charles Pedal Program got from the Central Oregon Health Council. So this is just a report out on what we've been doing in the meantime and what our plans are moving forward. So we've set up a steering committee that meets monthly. That's made up of right now leaders from Mosaic, COPA, St. Charles, and Pacific Source. We've also reached out to High Lakes and Summit to see if they have interest in participating on the steering committee as well. And so far, the general direction the steering committee has set is working towards a community model that's similar to the existing pediatric hospitalist model. So that model, for those of you that aren't familiar with it, we get some additional MPM from Pacific Source to help fund the program. And then there is a contractual partnership between a few different entities that creates a governing committee for the program and shares upside downside risk of whether the program makes or loses money and helps govern and make decisions about how the program runs. So as a high level framework, we're kind of moving that direction. The steering committee set up 2 subcommittees that each meet bi-weekly. The clinical committee is tasked with identifying what are the critical clinical services that are needed in the community. The PEDAL program right now does a pretty broad array of services for high needs children. And we're just getting feedback from the community on what of those are most critical. Do we need more of this, less of that, so that we can really target it to what the community needs. Excuse me. Then we also have a business committee that is doing the in the weeds work of creating the financial model, the legal structure for what this partnership could look like. Next slide, please. And if anyone has questions, please feel free to just interrupt, jump in at any time. So the clinical committee, so far, they're in the process of administering a survey to community providers, just asking what do referring providers find most useful about PEDAL? Like I already mentioned, what do they find the most critical? What would they like us to add, et cetera, so that we can really tailor the long-term program to what the community needs. We'll also be bringing in some patient families to understand their experience going through the program and their feedback as well. So the business community, or the business committee, we engaged MedMan Consulting. Pacific Source was kind enough to bring them in and help do an assessment of the program. Where do we have opportunity to make changes to optimize the program? So we're in the process right now of going through the details of their recommendation, what can and should we implement to help optimize the program to minimize as much as possible the financial commitment to keep this program going and sustainable. And simultaneously, we are creating a draft agreement, like I said, kind of based on the high-level framework of the existing pediatric hospitalist program. So working on creating that draft contract so that we can actually start reviewing actual language on a page and start tweaking to what we actually need and move forward. So next slide, please. So just an update on the funding. We received the $1 million in bridge funding through April. 240,442 has been spent, leaving just under 760,000 remaining. So our goal is definitely to hopefully have a longer term sustainable program in place while there's still this bridge funding helping fund the program into the future. So that is where we're at. Are there any questions?
I think any questions in the room? Do we have any questions from our virtual attendees? I'm not seeing any.
Hey, Tammy, this is
Yep.
so I was just looking at the Pedal website, and it says that this is targeted at children and youth with special health needs in Central and Eastern Oregon. So I just want to make sure that I apologize, it's hard to do virtually, but whoever just spoke is aware that we worked at the Latino Community Association. We worked with Oregon Health Sciences University, Ocean Center for Children and Youth with Special Health Needs, I think is the name of it, to do some focus groups with our Spanish-speaking families with children and youth with special health needs, and generated a report out of that. So I would just like to make sure that you're aware of that report, and if not, provide you with that report.
Yeah, Brad, this is Mike Richards with St. Charles that was talking. So
yeah.
I would love to get a copy of that. Thank you very much. And I can, I don't know if someone organizing the meeting could provide an email address, and oh, there we go. It's in the chat. Thank you.
Yes. Thank you, Brad, and thank you, Mike.
All right, thank you. I'm happy to answer any questions if people think of anything comes up after the fact.
Excellent. Okay, well, we will certainly count you in as a resource, and thank you for the update. So next I see Gwen on the screen. So I'll go ahead and turn it over to Gwen, who's going to give us an update on the behavioral health surplus spend, which is a collaborative conversation that's been happening. And so look forward to the update. Gwen, I'll turn it over to you.
Hi, nice to see everyone this afternoon. I can go ahead and project. I'm prepared to do that, Health Council staff, and I appreciate the questions on the back end in preparation for that. So staff are coming to you specifically today as board members and organizations requesting that you consider proactively supporting the behavioral health priorities collaboration. That's the behavioral health surplus work by serving as a fiscal or backbone organization for the collaborations that are coming up. So let's see next. Okay, here we go. So just to do a quick refresh, a few months ago, the CCO had a shared savings behavioral health surplus. And there's some attachments in your meeting packet for full detailed information. You're welcome to take a look at. But it was about 1.4 million. The deadline is to have it distributed and checks cut by June 30th. The leadership of the region identified 3 priority areas for behavioral health specifically. And then we're also matching that up with Oregon Health Authority funding guidelines. So since we undertook this endeavor, our community partners that have included folks from across 3 work groups and the Community Advisory Council have been oriented to the needs and priorities. They've done an environmental assessment of each priority and done strategic thinking about how to address each of these priorities. There's been extensive review and vetting of these strategies against funding guidelines, as well as some other historic documents and research and community conversations that have happened around behavioral health needs in the region. And those details are also included in your meeting packet. So what's happening next? This is where we are asking for your support. Next Wednesday, when the collaboration group meets together again, organizations and individuals are going to have an opportunity to opt in or choose to support a priority and a strategy alongside other organizational and community partners. We're going to be calling these collaborative teams. They're, regional collaborative teams. At each collaborative team, they're going to identify at a concept level some of the following: how they would collectively support the strategy, how each organizational community partner will support the strategy in concert with each other. So what they're going to do as a whole, how each organization or entity is going to support it individually, what's their unique strength and skill that they're bringing to the strategy. And we're asking that each collaborative team identify a partner within their team across their organizational partners to act as a fiscal agent or point person or backbone organization. Because they are functioning as a team of organizations, we're asking somebody to just act as the money holder and fiscal agent. So our request is many of your organizations have been involved in these conversations at the community level and the work group level. So we're kindly requesting if your agency is, interested, if you're able, if you're willing to serve as a fiscal or backbone organization for one of these collaboration teams, please consider it. And if you are, please, before next Wednesday, this is the tight part, please talk to the staff member you have that's involved. Let them know, have a conversation about how your organization can serve as that fiscal agent or point person or backbone organization for one of these collaborative teams. And talk to your involved staff member about your organizational partnership strategy, including what your organization can offer and how your organization can be flexible in this creative space. So happy to answer any questions or try to answer any questions. But that is our ask. It's exciting, creative work. There's been a lot of excitement and collaboration around the priorities and recentering and rethinking of this cross-sectoral work as really regional teams to get at these priorities that we've started touching at, but still need a lot of support. So it's been exciting to watch and exciting to be part of. And we appreciate your help and leadership in this space.
Linda has a question and then I'll turn it to anyone else as well, please.
Thanks, Gwen. I'm a little confused about the request. Are you asking if the council would consider being a fiscal agent or the individual entities represented on the council?
The individual entities.
Okay.
So for example, some of the organizations that have folks who have been involved are Latino Community Association, Best Care, maybe the school districts. So would those organizations be willing to serve as a fiscal agent in these collaborative teams? Not calling any of you out, that's just a concrete example.
And do we have a list of requirements that or expectations you would be filling if you were to say yes to being a fiscal agent?
We're in the process of developing that fiscal agent. We're looking for somebody to hold the money primarily, a pretty traditional understanding of fiscal agent, so that the team then has runway to develop out their concept and do further work, and that those funds are held as they do their creation and build out their details of their activities and plans.
Well, I would only add that I want to acknowledge the work of Gwen and the team in this area, and personally anything I could do to support it. I'm not qualified to be a fiscal agent, but it seems like a great initiative and in the right direction.
Great. Teeing off from Linda's question, are we hoping to have multiple fiscal agents, or is it better to have one? It helped me with what does a perfect world look like? I'd
love to tell you what a perfect world looks like. What I can envision at this point, however, is that we have 3 different priorities with some strategies around each priority. I'm envisioning that there's a collaborative team that are all focused on activities around that strategy. So like one organization per strategy or collaborative team would probably be sufficient. If there's an organization that's willing to be fiscal agent for multiple strategies, that's fine too. I think it's super open.
And
We're
would they
looking
be,
for people to hold money.
would they be convening the group around the spend and the creative thinking of how you invest? Or is it merely that they are the true fiscal sponsor that someone is just asking them to cut a check?
I think it's primarily the fiscal piece is the primary concern. The trust is that these teams will identify who's their lead, how are they going to meet, and develop that plan in amongst themselves as time goes, as we give them opportunity and time to do that. So we're looking for that concrete, just the fiscal piece at this point.
And it holds some equity for smaller organizations to be part of that initiative. And so stronger backbone agency would allow that and also create the collaboration within that initiative.
Okay.
Yeah, thank you for that.
I think in the nonprofit, one of the expectations I would have for a fiscal agent would be an agency that undergoes an annual audit. I just think that provides some good checks and balances, and not all the small nonprofits do that. So just throwing that out.
Yes. Brad, did you have a question?
Yeah, just clarification on what, so, and maybe Carmen sort of just answered it, but I still need clarification. So is the Health Council choosing, are you restricted from receiving these dollars yourself?
No.
Or you're actually making like an intentional choice to give the funds to 3 organizations.
No, so
I'm confused about the fiscal sponsorship thing, like why that's.
Yeah, let me clarify. So we want the community, so the concept is that we want the community to identify where in these strategies and priorities do you fit and can use your strengths. The COHC staff and leadership, you know, we can't answer that. You all hold the wisdom, the regional partners who've been involved in this. And so involvement as a fiscal agent does not negate your role in the partnership. Each collaborative team or each priority is going to be allotted an X number of the dollars available to work on that strategy. And then that team will identify what's going to be done, the timeline, how to budget those funds. So I hope that helps. So the answer is it does not exclude folks from being involved or contributing to the strategy.
So will those funds go directly to the organizations, the fiscal sponsors? Or are they going to the Health Council first and then to the organizations?
That's a money flow question I would defer to. So I think the Health Council is holding those funds. They will be transferred to the fiscal agents to hold in trust for the work of the collaborative teams. Carmen, I'm looking to you.
That's correct. That comes from the behavioral health surplus. The reason why that we're trying to do this and meet all the criteria is the spend needs to go out by June 30th, which Gwen mentioned earlier. And so in a way to do this so that community partners are involved and we are still listening to what the community needs are, those 3 initiatives were called out from the work group. And in order to do this successfully, you know, we'd like 1 fiscal agent for each of those initiatives. We want for all, maybe 2 and 1, whatever the combo is. But centered around that, we have a strong backbone agency to deliver that initiative forward, as well as having other participants, smaller nonprofits, community folks that want to still lean into that conversation so that it's a community decision. In the past, what has happened is that folks will come to a space and ask for funding specifically for their organization. And so what we are really trying to do, which is in our strategic plan, is do a lot of cross-collaborative efforts across the community. And this is happening specifically with this group. It went to the behavioral health group, and housing and substance use were also included to have this discussion, which are great alignments for what we're trying to do. Not to mention the overall strategy with the $14 million that Tammy is working on specifically for housing. Hopefully these funds would wrap services around for the need of the housing community as well. So, you know, we're just trying to really tie up everything in what's happening in the community.
So with the, yeah, so with transferring those dollars to those 3 fiscal agents, allow the health council to comply with that June 30 spend, but then those fiscal agents would have how much time to actually spend the money?
However
So-
much, yeah, whenever the time that the collaborative team needs to spend. the
Okay,
money.
okay,
Yeah,
that makes
so
more
that
sense.
that gives the flexibility of the deadline being met and the development runway that these folks will need to plan out the details of what they're going to do. Yeah.
Okay, that makes a lot of
Yeah.
sense. Thanks.
Yeah. I did want to just clarify that this upcoming meeting is during the regularly scheduled behavioral health access and coordination work group meeting, which is this Wednesday, the 17th. It's from 1 to 2:30. I did hold on, Monday. I think it went out to y'all Monday or Tuesday morning. Sent out a specific email to y'all with the ask, the details, the priorities, the meeting time as well. So you have that. It's also included in your meeting packet. And I can follow up with anybody offline if you have any specific curiosities around your organization and who's been sitting in this space with your organization. Happy to do that.
Do you have partners that you anticipate raising their hand? Or is this truly casting the net saying, we have until Wednesday, we need some help? Okay.
It's truly casting the net. Yeah, I'm not bold enough to so yeah.
I would just offer that, well, we do this on behalf of organizations in the region, and I think getting to Rick's point around the audit functions and sort of the eligibility and the spend, there's a bit more than just taking the funds. I think there's the aspect of making sure that they're being spent in the right eligible cost centers, and that, you know, we'd be happy as an organization to either share the contract that we use when we do this already, or to be a partner in helping to buy some time to give you the chance to cultivate maybe a more appropriate partner, or you know, sort of sort through what that looks like longer term. But just out of the gate, I think there might be some more. I know that my CFO would be asking a bazillion questions right now that I wouldn't be able to answer. Yeah, because ultimately it wouldn't be the health council getting audited. It's going to be that organization that's taking the funds and spending the funds and doing all the great things. So, and I'm sure you've considered all of that, but I would just throw that out there as if we can play a role, happy to support you in this short time frame. But that is the net being cast, looking eyes. If anyone wants to raise their hand and take this on.
Yes.
Or you're happy to think about it, and we'll come back to it during the meeting time on Wednesday as well. So that's great.
These proposed are kicking the shins of the CEOs when they read this.
Oh, sure. Yeah. Yeah.
Are the dollars divided a third between those 3 areas of priority? So the plan.
Potentially, is that I'm not sure what the work groups are doing with that at this time.
We're leaning towards that. We've discussed a couple different models, but our initial thinking, if you're just curious about our thinking, is that being that this is a first regional attempt at this, that might be the easiest, most direct route. We've had some other conversations around distributing them based on like inverse proportion to how RIP funds have been invested. That might be a little bit of stretch. We're trying to work in the readiness of our community partners and organizations as well in this work. So choosing where we stretch and where we stay a little bit more comfortable.
Thanks. And ideally, we'd have one fiscal organization for each of the 3 areas,
Potentially,
but potentially more.
I don't think so,
I know that seems
Yeah.
like it might get complicated.
right? The intent was really just to have strong backbone organizations focused on that specific initiative, but maybe one organization can handle 2 initiatives, I'm not sure. But I think that's what we'll find out.
That was gonna be my next question was, one organization said they'd be happy to be the fiscal for all 3 areas, earmark the funds accordingly. And then because it feels like we're saying we need somebody to hold and steward the dollars, if you will. And then the work group is gonna form the strategy and the execution plan, and then dollars will pass to that, right?
Right. Exactly, to
So
meet
it
the
could
goals
be-
of.
It could be a 3 to get 3, it could be a 2 fiscals to get 3, it could be potentially even 1.
Right.
If somebody said, no, we can earmark these in 3 areas to be allocated appropriately when the tactical work plan is ready.
Right.
Yeah, I mean,
Fair,
fiscal
right?
agents don't make
Fiscalists.
decisions, they just write a check. When they can see that the approved process has been done.
Yeah.
Right. Yeah, so, okay, you've gone through whatever your process is. And you got a formal decision, you write a check.
They're gonna wanna know what is that criteria that you can spend on.
Right.
Can you allocate
What are the
funding to?
limitations?
Yeah, right, right.
Because whatever you're doing there has to pass your own audit.
Right.
Right.
But you're looking here at La Pine as one of them. So does that mean that Deschutes County and what we're doing in La Pine is gonna be one of those quote unquote agents? And when does this money actually have to be implemented? Okay, I know that it has to be distributed, but then again, like ARPA funding, something has to be done by 26, or the money actually has to go back. So do we have a date, an end date where something really has to be done? Because I think that's very important.
No, that's
We're
a
talking
great,
it, yeah,
that's a great question. I think that those are the specifics that we would work with, with the fiscal agents. We've actually done this before with some of the behavioral health funding. It actually went to, I think it was it COSPA originally? And then it went to the learning hubs, and then they're now doing that work. So, we are tracking this. All of this is tracked in our grant platform system. And we will put some parameters around what that looks like, because I agree. I mean, I do think that you're gonna put a strategy and it does need to get implemented.
I think the question might be a little broader in terms of are there restrictions on the funding, or is it truly that we get to determine by what date the dollars have to be out the door and to what expenditure, like what creative idea? Like much of the funding that we all receive is very restricted, that if you don't spend it by a certain date for a certain purpose, you either need to give the dollars back or there could even be penalties.
Right.
So so are we, is it truly that we get to decide if the dollars go out the door by the 30th, and then the new fiscal sponsors have 5 years or 2 or?
The joint management agreement doesn't stipulate any additional dates in that
Okay,
space. The
so that's super
specification is
helpful.
For the health council to
Right,
spend,
okay.
and then any additional caveats and, ideally, lifting up projects that would impact our membership earlier, I would think would rise to the top, but not a agreement or contractual obligation.
Commissioners that help?
Yeah, well, it helps. I just think the more you specify, the better it is, because if we give out 38.4 million, but if they're not doing the job, we're actually gonna have to get the money back in some cases.
And I'm assuming that with each fiscal agent, we develop an MOU or a contract or something that says for this abuse of data. These are the agreements we make, this is how it'll be done, reporting, it's that.
We would monitor monitor it no differently than grants that we actually push through our grant platform. And again, we did this before with our behavioral surplus spend. We did it with those 4 agencies like medicine, Kobo, Central Oregon Volunteers. So we have done that before, and it's still being tracked.
Yeah, no. Yeah. I think that statement around the genesis of the dollars lifts some of the concerns that I think we're probably starting to articulate, Gwen. So yeah, if they're really truly sort of unrestricted, I think it gives you a whole lot more open field running.
Yeah, so we don't have, there's no, as Trisha, I think it was Trisha mentioned, there's no deadline. If you look on into your meeting packet, there's some vetted strategies that and examples of strategies that tie in to the work that the collaborative, the community groups have done. They've been vetted against the funding guidelines that we do need to adhere to. And they've been tied into other regional documents around needs. And so those are the guidelines, as you're talking about, what can people spend it on? We've really developed that out and making that available ahead of time as we emailed it to y'all earlier this week and to the partners. So there is some scope. And as Carmen mentioned, it of course is going to be tracked and monitored through our grant system and supported on the back end as always. So
awesome. It's a unique ask. So thank you for being patient with our question. Trisha, go ahead.
Yeah, I just want to share from a CCO perspective that I appreciate the increase in equity and transparency in this process. It had previously been a handful of people at the table, so really expanded Carmen and Gwen and the team, the amount of people who are weighing in to these significant funds in our community. And I think that some of the unknowns in this space is this is a new process, and some of these late asks and Pacific Source granted an extension of spending in this space to increase the equity in this. So I just want to give props to that in this work, and it definitely puts us in this, like, we don't know all the answers just yet, but I really look forward to next year when we're ahead of this, and we're looking right now at over $8 million going back into shared savings. So you know, we get the opportunity, Tammy, to do this again.
Yay, good. We'll refine the process. Okay, so any other questions? That's a maybe. Dan? Okay, all right. Okay, anyone else? Okay, so.
Actually, you
No. You guys know the vibe.
I think it's a simple one. If a fiscal said, hey, we need 2% of the dollars to be the fiscal or something, right? Because it does, you know, it's a process to do it, right? It takes one person, maybe 6 more. Is that acceptable? As we talk to potential fiscals.
Is there a limit
We
to
just
that?
need to hear from them.
Yeah.
What do you?
I
What do
think
you
that's
want to do, or what do you need to do this, right?
right. I think that that's a given, that a fiscal agent would take some admin on top of it to do this, so. Just the way we would with any other, but great question, thank you.
Go further questions.
Absolutely.
Okay.
But what is the limit? Is it written down somewhere for the admin costs?
In terms of an admin piece to it,
Mhm.
you know, every organization, I believe, asks for that. I don't know what it is across nonprofits, but normally it is between 2 to 5%. But you know, a lot of times if you're a fiscal agency for another nonprofit organization, you're really trying to help them out. So it's a lot more. I don't know what other thoughts are for.
Well, I just had a
organizations.
grant that came through the county and they hadn't applied for it for a while. By the time I got done asking the questions, 25% of the funding, it was called a grant, was going to be kept by the administrator. And then the people actually getting the grant were going to be paying interest on their loans when their properties were sold. And I thought, wow, I can understand why we haven't really, you know, when you get done asking all those questions, you get a little concerned that why if it's a grant, why are these people being charged? And they were low income people. And it was repairs on their property that they needed, but they didn't have to pay it back till it was sold. And I thought, oh my gosh, these people are going to forget all about that little lien out there. And then they're gonna have a big, you know, a 6% interest on it, and it just seemed really unfair to me. So, yeah.
I think you're gonna have a range, well, maybe this lady, or a number of people, they're all in our mission, and so we don't charge anything. And so, it's just, you know, part of being a nonprofit, it's some places you find your profit, and some places you don't find your profit. And so it just depends, right? If it's outside of our mission, we probably wouldn't do it, or if we did, we would charge full freight, which is 14%.
We may want to look at our past agreements and see if there's any sort of consistency within what we've done in the past. So,
And you do bring up a good point, Rick, that, you know, this initiative may align specifically with that organization's mission, which is why they would take it and maybe say, there's no, you know, we do this every day. There's no administrative fee that's necessarily attached, or, you know, an initiative around housing, and then that gets taken in by a strong housing backbone CBO. So we're hoping that that's not going to be the case.
so what happens if you don't have anyone raise their hand between now and Wednesday?
Well, Linda just said she was
Yeah.
gonna do it.
Greenfield Gal LLC.
Yeah. Work on the logo right now.
Did y'all find a conflict of interest?
So I just would, yeah, so we've had occasion where other jurisdictions have been in the same situation, although a little more sort of restricted. So again, if you need a Hail Mary pass, happy to help out, but we might not be the right long-term, certainly happy to engage short-term.
Right, that makes sense. So, yeah. Thank you.
You can be the fiscal until they find a fiscal and then.
Yeah. I don't know if that even, but I mean, sounds like we're got a little tight timeline, so, yep. While we're developing the LLC and logos and t-shirts. Okay. Any other questions or notes? I love the creative thinking. Thank you, Trisha, for raising that as well. Gwen, thank you for your hard work and leadership, and Carmen and to the entire team. So any other questions there? Okay, go right ahead, Gwen.
Just wanted to thank you all for your consideration and your patience as we, you know, work through this new process, and your care as well, and concern. So thank you so much. Appreciate it.
Absolutely.
Keep up the great work.
Yes. Okay, so moving on to the Regional Health Assessment Toolkit.
All right, so I want to introduce Carol Martin. She's a temp for us. Whitney was not able, she's not feeling well, her baby's not feeling well, but Carol put a lot of work in putting these, remember how we talked about our regional health assessment, and we're having a contest with each of the organizations. So Whitney specifically is going to give you a QR code specifically for your organization. And you're going to have cards, and it'll have in little tiny letters COIC. So for example, if anybody does a survey, COIC will get the credit for that. And
So they
then
all
we
say
will be-
COIC?
No. Yes. Right. So, would you want to come up here?
We put together a toolkit. This follows on from an email that Whitney sent out to all the board members around about the 22nd of April.
Yeah.
And in it, there was a Gmail link to a shared drive where you could get all these documents. But we put together a hard copy one for the board members. And in it, you will have a thank you letter from Whitney and from Miguel here, saying thank you for promoting the survey. You'll have a hard copy of the toolkit. This is basically what it says. It's, if you look at the drive, it's the one that says read this first. And this tells you what to do with all your various bits of documents. It's got, I'm going to give you some flyers, a couple of posters and some business cards, but also on that read link are social media graphics, lobby flat screen slides, campaign logo, your own QR code for your various organizations, and a newsletter article that you can put in your own newsletter. And then on top of all that, each board member is going to get 250 business cards, which Carmen's just shown, but it's English on one side and Spanish on the other. And the tiny little QR code does have your initials underneath, but you need to find a magnifying glass to see it. We had to look at it with a camera this morning on our phones. We couldn't work out who's who's. So at the end of the meeting, I'll just hand you these packets out. But anybody else who needs the link, the electronic link, just let me know, and I'm sure that we will send them out to whichever organization link it needs to be. Because each, but we do have a generic one as well. So for instance, Carmen just has cards with no company on it. And I have checked, these tiny little QR codes do pick up on your phone. Because I promise you, I've checked every one. I haven't checked the 250, but I've checked the ones on the end of your box.
Okay, and these are just the physical materials, but there are some agencies that are actually putting it in their waiting rooms. So
Yes.
you can do stuff like that. I mean, if you are putting poster boards and while people are waiting for in the copy line, I mean, just be as creative as you'd like to be, because people like to do something when they're sitting there waiting. So and we can send you some more of those ideas too.
I believe Mosaic is going to put a card into every prescription envelope.
Oh,
So maybe over there will be a card in the package. There'll be a card, take the survey. So hopefully,
All of that where we have a addiction medicine program, so we can have active fentanyl addicts. And we just heard it.
you do every someone enters the survey each month. We put the name. There's a number generator, and we have prizes to give away as well. So we're on our second month. Top prize each month is a Mac Mini, followed by an iPad, and then we have 5 grocery or gas cards available as well. My problem is that people think I'm scanning them when I send them an email. Oh, you're
Don't forget those all the time, like, yeah, right.
Yes. Which is, we had one gentleman ring yesterday, ring the office to say, is this right? We're all there? Yes. So if you just get, if anybody wins, then tell them, please, it's not a scam. I am trying to get you a grocery card or an iPad or a Mac Mini. So.
And I do want to recognize that St. Charles, we're in partnership across the region, as well as all the public health county directors who are all working together. St. Charles actually donated a lot of the iPad and Mac Minis, so just wanted to acknowledge them for that. So if you'd like to donate anything, let us know and we'll put it in the fine pack.
It's 7.7 months. Right?
Yeah.
And all the material and instructions are in bilingual.
Good. Tell us who your operations force.
Yeah. Do you want to partner with it? Do you want to be part of CYC? Right? I mean,
I'll just give everybody my cards to distribute, and it'll all be good.
love it. Okay, well, Carol, thank you. Wonderful to meet you and welcome to the team.
Yeah, Carol used to work in Deschutes County, so it was really lovely to see her today. So thanks for joining the Health Council.
Okay, so I think we have come to the end of the rainbow. Do we have other items that we want to bring forward?
Well, let's not talk end of rainbows.
Oh,
we need more rain, right?
A little bit. Yes.
Well, we're at 96% moisture, including snowpack and rain. I was at the water storage meeting this morning for our county. So it's really actually, we're going the right way. So 96, yeah, we need 100%.
Good. Every day that we have a little extra moisture is good. So as a recap, June retreat. look for that survey in your inbox. If you don't have it, please signal and we will resend tomorrow or today, possibly. And another survey will go out that is unrelated, but that is related to feedback for the executive director performance. So we will be having, as I mentioned, a short executive session to discuss that information and to be able to give your executive committee the right direction in June. So we'll meet with Carmen. And so please look for that one as well. And an outline of when we will be seeking that information back. I believe it'll be the week of the 22nd that we're hoping to have that back by. Any other updates that we want to make sure that we have?
I guess just a friendly reminder that July we go dark, so there won't be a board meeting and I will actually be gone for a month, traveling out of the country. But at the same time, we'll probably still be checking in. Okay, so, and there will be vacations with staff too, so just kind of keeping that.
Okay, very good. All right, sweet. Anything else for the good of the order? Well, the gift of time is yours. Wonderful to see you all, and thank you for making time to be a part of the Health Council.